Okay, folks, here we go. I want to thank you all for joining AARP Massachusetts Advocacy Action Day. I'm Mike Fester, reporting in, the State Director of AARP Massachusetts, and I'll be hosting today's event. On behalf of AARP's 760,000 members in Massachusetts, I want to thank all of you who are participating in this very important event. I also want to thank many of you who have been involved in advocating on behalf of seniors, people 50 plus, in a lot of the work that we do. And of course, today is a focus on what we are trying to accomplish in the Commonwealth of Massachusetts. There's a lot to be done. We are being joined today by an extraordinary array of legislators and leaders in the community, and those who are very intent on addressing the issues that we are facing as a Commonwealth. Our focus today is going to be on supporting Massachusetts older residents and their families. We have prioritized helping family caregivers, helping workers save for retirement, and making improvements to the long-term care system, particularly to nursing homes. And we are very fortunate today to have many of those key legislators who have been really in the forefront of this effort, as well as the Secretary of Elder Affairs, many stakeholders, and those representing organizations that have agreed and are part of this Lobby Day effort. Now, we've got a tight schedule, as you might imagine. This is a full hour. It's going to be jam-packed, and my job is going to be keep things moving at a strong and thoughtful pace. We're going to be hearing from our AARP priority bill sponsors, by the way. But before we get to that, I just want to do a couple of quick housekeeping matters. Number one, if you want to ask a question or make a comment, you can use the Q&A feature, and those questions or comments can be addressed live or in chat, and we will, of course, reply to that. In addition to that, we're recording this session, so if you can't stay the entire time, you know that you can review it after the event ends. So now we want to start the event with a very special message from the Speaker of the House of Representatives, Ron Mariano. Mr. Speaker, thank you for joining us on this video. Take it away.
Hello, everyone. I'm Ron Mariano, Speaker of the Massachusetts House of Representatives. Thank you for inviting me to speak with all of you today. I want to thank the AARP of Massachusetts for all of the work and advocacy that you do on behalf of the Commonwealth's older residents. Without your efforts, I know the support system for our aging population will look very, very different. From healthcare access and affordability to housing and economic security. Seniors in Massachusetts receive better care and have more benefits because of your consistent hard work. Ensuring that we do what we can in the House to support seniors across the Commonwealth is a critical responsibility. I'm proud of the work the House has done to support our seniors since I took the gavel. In our FY23 budget, the legislature included over $19 billion for mass health, which seniors rely on for access to comprehensive health care coverage and to receive long-term care benefits. The budget also included strong support for our local councils on aging that provide critical community programming and support of our seniors, as well as funding for behavioral health services for older adults and for the nutrition services program. Additionally, the budget allocated significant funding towards the SHINE program to help older adults navigate their Medicare benefits, as well as with booking vaccine appointments during the pandemic. Last session, the House also passed legislation that makes key reforms to the governance structure of the veterans' homes a necessary step in the effort to better care for our aging veterans. Although the pandemic is behind us, it's still so important that we continue to support our seniors and caregivers. Looking ahead, please know that my door is always open Your feedback on all issues related to seniors consistently helps to better inform our policymaking. So I want to thank the AARP of Massachusetts for inviting me to join you all today and for the ever important work that you do. It was great to speak with you all today. Thank you.
Thank you, Mr. Speaker. That was great, a great introduction to this lobby day. And needless to say, we appreciate your leadership on not just the issues you just mentioned, but fundamentally, and in particular, as we look at reforms to the long-term care system, which we know you have made an important priority as well. At this point, I would like to turn the program over to the lead volunteer for AARP Massachusetts, our state president, Sandra Harris, and she is going to start a discussion on aging in the Commonwealth. After she speaks, she's going to be followed by the Senate Elder Affairs Committee Chair on the Senate side, Pat Jalen, as well as our friend Tom Stanley, who is the House Chair and the Secretary of Elder Affairs for the Commonwealth. Sandra, you have the floor.
Good morning, everyone. As the lead volunteer and on behalf of our 760,000 members in the Commonwealth, I welcome you and I thank you for being with us, and special thanks to all of our legislators and distinguished speakers who are with us today. AARP is a nonpartisan, nonprofit membership organization for people 50 plus. Our mission is to represent the 50 plus on issues that matter to them: health security, financial security, and livable communities. Did you know that in 2020, the 60 plus cohort comprised 24% of the Commonwealth's population? Adults 60 and over in Massachusetts will soon eclipse the under 20 age cohort for the first time in recorded history. And as our aging population continues to grow, so does concern over unique issues related to financial, health, and long-term care needs. Both planning and action by the Commonwealth are required to make our society work well on behalf of all of our residents. We at AARP stand ready to help, to do our part, and we thank you for standing with us. We'll now hear from Senator Jalen. Welcome, Madam Chair.
Now you can hear me. Thank you for letting me join you from beautiful downtown Amherst, where I'm coming back from visiting my granddaughter. And thanks to you, Ms. Harris and Mike Festa and Jessica Costantino and Antron Watson and everyone who's here. I'm really fortunate this year again to be chairing with Rep. Stanley. And we are ready to turn the promises we've made, our priorities rather, into realities, especially with all of your help. Next Monday, we'll hear 3 priority bills, which came out of last session, which Chair Stanley and I are sponsoring, which he's going to talk about, bills to improve care in nursing homes, assisted living, and home care. But there are also many other important bills in our committee that we hope to advance, including a bill on property tax deferral for seniors that I filed with Rep. Batolo. Those of us who advocate for older people's needs have never felt, in the recent past at least, that those issues have been enough of a priority in our state, despite the fact that, as you pointed out, the older population is growing really fast, and despite the escalating crisis in all levels of care, from home care to nursing homes. So there's so much urgent work we need to do to strengthen the whole continuum of care. Of course, we need to make nursing homes safe, but many people need assistance and don't need nursing facility level of care. So we need to preserve the remaining rest homes and expand supportive housing. And we need to develop new models of care, which we don't yet have in Massachusetts, including personal care homes and small house nursing homes, as well as affordable assisted living. Our biggest challenge right now is the shortage of workers across the continuum of care, from ambulance drivers to ER workers, to hospital workers, to rehab workers to home care workers, and that results in worse and much more expensive care. Caregivers aren't paid enough to live, and salaries don't allow caregiving to compete with less demanding work. So we need to increase pay by increasing the payments to agencies. And to nursing homes. We need to increase their pay enough to attract, train, and retain these truly essential workers. So we need to beware of proposed tax cuts that benefit only the most wealthy and would keep us from adequately funding the care we all hope will be available when we need it. I'm so grateful for your advocacy and so happy we'll be working together to make this session the one when we finally take some real steps to care for each other as we grow old.
Thank you, Senator, and thank you for all of these years of great leadership on this and many other issues that you care about and that we certainly support you on. Love the shades, by the way. Very cool. I hope it's nice and sunny in there. Well, speaking of great leaders in elder affairs, Tom Stanley, Mr. Chairman from Waltham, Watch City, it's great to have you joining us. And you now have the floor. So please give us your words of wisdom and support.
Well, thank you, Mike. Good morning to you and good morning to everyone else. It's great working with you on these very important issues as we got to know each other as colleagues in the House of Representatives. And you were always a strong advocate for elder affairs back then. It's also been a real honor for me to work with Secretary Chen and Senator Pat Jalen over the last few years in my role as Chair of Elder Affairs for the House. We've worked on a number of important issues for elders and all the advocates who do a great job of helping the legislature and the administration come to good legislation to pass. And so this year, we're hoping to, and I feel confident that we'll be able to make some positive changes and enact some legislation in the area of home care licensing, common sense bill, which, assisted living residences, and also long-term care across the whole continuum of care for elders. The pandemic has taught us how serious and essential our elders are, and also the people that care for them and people that work for them. So, there's a number of things that we've identified with the help of AARP and all the other advocates that we could improve upon. With home care licensing, we want to ensure that every consumer knows exactly who they're hiring and what services they're providing, and that they are certified to do the work that they claim they're going to do. And with regards to assisted living residences, a number of services were allowed to be provided during the pandemic in order to keep folks from moving into long-term care facilities where, as we all know, COVID was running rampant. So these services are things that we're going to move to try to adopt and make permanent long-term. Things like, oxygen management and providing insulin for diabetics and eye drops and some other, minor wound bandaging, things like that, that families would have to do for themselves for their loved ones in assisted living, or they would have to hire nurses at a greater expense to them and their family. So in the last and very important long-term care bill, we know how difficult it is to find good work throughout the country right now. And the people that take care of our elders are extremely important. So we've developed grant ladder programs to help employees to get better training and more training so that they can perform their work and to move up the ladder. And also, tuition reimbursement, things like that, to make it more affordable so that we can have the best workforce that we can possibly have. And also providing new tools for the state Attorney General's office to punish nursing home owners that are, not keeping our facilities safe. And, there's a whole host of other items as well. It's very lengthy that we've talked about for the last 3 years, at least while I've been chairperson, but much longer. And with that regard, I want to thank Senator Pat Jalen for her assistance with me and talking about all the issues that she's worked on for a decade or two. So with that, we're very excited. My mother's 83 years old. I understand the difficulties and the challenges that go along with aging. And, we love our seniors. We love our parents, grandparents, and friends, and the people that, made our worlds a better place as we grew up. And we want to do our best to make their senior years as comfortable and productive as possible. Thank you.
Tom, thank you very much for your kind comments. And, we just to remind everybody, right around the corner, next Monday is going to be the first hearing of the Elder Affairs Committee with both you and Senator Jalen speaking to matters involving, in particular, long-term care. So there's going to be a lot to be done. In fact, some of the questions that are coming through, we'll pick up after we finish with our third very special guest. But I want to remind folks, if you do have questions, put them right in the chat. They're coming through. We'll try to answer them as we go through this program. Without further ado, Secretary Chen, great to see you. Thank you for your leadership over many years now. And you have the floor. So please welcome to AARP Lobby Day. Thank you.
Thank you. Thank you so much, Mike. Thanks so much for inviting me to participate in the AARP's Virtual Advocacy Day. I have great memories of my first time participating in Advocacy Day now several decades ago. And I continue to feel privileged to live in a world where lawmakers want to hear our voices, in particular the voices of older people. I am grateful to Chairs Jalen and Stanley and their staff who really get it and who are such strong advocates and lawmakers on our behalf. Now, EOEA serves 1.7 million older people in Massachusetts. We strive to ensure that all older adults and their caregivers can live and thrive in the communities of their choice. This work takes into consideration a population that's experiencing varying degrees of physical, cognitive, and emotional changes beginning at the age of 60 and through the centenarian years. Let me share some additional information about the EOEA component of Governor Healy's proposed budget. EOEA proposed $711 million in fiscal 24 to help older adults remain safely at home and in the communities of their choice. This includes supporting nutritional wellness, providing in-home assistance with activities of daily living, protecting older adults from abuse, neglect, exploitation, and self-neglect, and includes our role as the regulator for assisted living residences. Our work also includes helping older adults and their caregivers thrive in the communities of their choice. This part is really important. It's not just, we can't just be safe, we need to thrive. EOEA offers programming that encourages older adults to engage socially and in the broader community. We provide respite to support family caregivers, and we strive to address behavioral health and emotional wellness before stressors become crises. We carry out our programs through critical partners in the 350 municipal councils on aging. They operate the local senior centers. We also have critical partners with the 24 regional aging services access points that we call ASAPs and the 20 federally designated aging area agencies on aging. We call them AAAs. They help us carry out our programs. The proposed budget includes funding to all councils on aging. It includes an increase from the current $12 per older person to $14 per older person to support local government in their critical role in helping older adults live and thrive in their own communities. The proposed budget also includes a 6% or $43 million increase to our home care programs. And the home care program serves about 65,000 individuals of all income levels, and 20,000 of them are eligible for nursing home placement, but able to stay at home because of home care. Lastly, the proposed budget includes supports for mental and behavioral health needs in the community. Our network currently offers elder mental health outreach teams. We call them MHOTs, that serve 166 cities and towns. And the budget includes $2.5 million to continue funding MHOTs. This investment allows the teams to reach 40 previously unserved municipalities. And so as we look into the future, I see a collective resilience after we've been through the throes of COVID. There's a renewed energy and an undeterred commitment at Elder Affairs and sister agencies and community organizations like the AARP. I know we will use our precious financial resources with the greatest care so that we can serve as many people as possible. And so I thank you for the opportunity to participate today. And thank you for supporting older people, their families, and their caregivers.
Thank you, Madam Secretary. And let me just again start right from the beginning in terms of who have just participated. Sandra Harris, our volunteer state president, Chairwoman Jalen, Chair Stanley, as well as Secretary Chen. You've given us some good insights into your thinking on the leadership on some of these issues, and we really appreciate your involvement today. I also want to note that we've got running chat questions, and I think as a practical matter, as we're going through the schedule, I want to be sure that we're addressing those. But I think as a practical matter, probably best to have our team, AARP. We've got some great advocacy folks, Jess and Austin and others, that will type in the answers. So if you have questions, know that we will respond to them, but rather than take airtime at this point, I want to be sure that we stay on schedule. There is one overarching point, however, and this is coming out in the comments. For those of you who are participating, who are members of AARP or advocacy volunteers and want to be involved, the fundamental point is this. For the legislators who are on this program today, I'm sure they would agree. They want to hear from their constituents. They need to know what's on your mind. They are elected by you and they serve, and they want to reflect your concerns as well. And so for those who have been involved in the issues that we're talking about today, suffice to say, they are genuinely receptive and interested in hearing from you. And in many ways, the best lobbying we can do is individuals like yourselves who have had experiences in long-term care or family caregiving or challenges saving for retirement. Your stories are really going to make all the difference in our success as we go through our legislative agenda for this year. So with that said, I want to now return back to the program and introduce a caregiving panel. We know in Massachusetts, this may stun you, but the simple truth is that there are almost 800,000 unpaid family caregivers in Massachusetts right now. And if you add up the value and just sort of the baseline cost of providing care, you're talking over $15 billion of care delivered at no cost to the Commonwealth. But at the same time, a lot of these folks are spending a lot of money out of pocket. In fact, the average is about $7,200 a year for caring for someone that they love. And so one way AARP thinks we can be helpful here is to acknowledge that a family caregiving tax credit would really help alleviate some of that financial burden. And this family caregiver tax credit can be up to $1,500 as a refundable tax credit based on expenses that would be eligible. And that's something we would do, would be done through the Department of Revenue. We have a group of folks who want to speak, who are going to be part of this panel. And I just want to let you know who you're about to hear from. First and foremost, James Lamastro, who's a family caregiver and in his own right, quite a leader in long-term care issues and policy. We have Senator Jason Lewis, who's the sponsor in the Senate of the Family Caregiver Tax Credit. We have Representative Dave Rogers, who's the sponsor on the House side of the Caregiver Tax Credit. And we're going to be hearing from each of them. So, Jim, we're looking forward to hearing from you right now. Take it away. You've got the floor.
Thank you, Michael. First of all, I want to thank AARP for supporting family caregivers. It makes it possible though the workers and others to take care of their loved ones to live independently at home where they really want to be. Most of us as caregivers work hard to keep our loved ones independent and giving them the dignity that they deserve, as well as keeping them out of an institutional setting. My wife and I were caregivers for my parents for about 10 years, for my mother and 6 years for my father. They lived in our house. We had to accommodate our house to us because they were at that time elderly, and my father had COPD and was pretty towards the end of his life impaired. We had the means to do it, and we did it. We did it willingly, and we did it willingly. I think the $1,500 refundable tax credit would have helped us in some ways to provide additional care for them that we probably wouldn't have to do. But I know a lot of families, and I work with a lot of families, who that $1,500 would be the difference between them remaining at home and going to a nursing home. It could fund, for example, a low bed. It could fund a ramp. It could fund something like some modifications to their security system so they could see where they are, and even be able to guide them remotely as well. So we are fortunate in our situation. I know one particular example of a relative of ours who lives with his mother and takes care of his mother, but she became very sick. She needed cancer operation and was incapacitated for a significant amount of time. He had to take time off from work, and that time off of work entailed some additional expenses. And fortunately, it didn't last very long. It lasted a month or two. But had he not been there, or had he not had the means to do it, she would have probably gone to a nursing home. And unfortunately, most of us believe she would have probably stayed there instead of remaining at home. So I really want to advocate that while the $1,500 isn't a great deal of money, considering the fact most people pay about $7,200, it might be the difference between whether or not someone stays at home and doesn't stay at home. These tax credits can help people live safely at home by, as I indicated, by purchasing things that normally they would not purchase. There are a lot of people taking care of their family members at home. So a lot of them are invisible. They don't tell you that, but when you get into that, you start taking care of your own family member, you talk to other families, they open up and they tell you what they provide and stuff like that. So this whole group of family caregivers is providing not only in terms of actual care, but they're also reducing the need for professional care, of which we are finding that we have significant shortages of. So they're the first line. So family caregiving is the first line of defense against unnecessary institution of older and disabled people, especially in what's getting to be some subpar nursing home situation. Family caregivers already provide much of the care in the state. If they didn't provide the care would fall to the state and local communities, and that would be an incredible expense to the state. But more importantly than just the expense that it might alleviate to the state, it enables the person to live in their own community and have that community get the benefit of that person living in their community as well. In addition, it also gives them a certain amount of dignity by living at home that they're not going to get if they're in an institutional setting. So I'm really strongly advocate that we look at this tax credit and that we tax credit and that the state pass it along so that people will have that benefit. Thank you very much.
Jim, thank you for those personal insights. And now I want to turn it over to my state senator and a great leader on this and a number of other issues in the Senate, Senator Jason Lewis. Thank you, Senator, for joining us. Thank you for being our lead sponsor in the Senate on this caregiver tax credit. So take it away.
Well, thank you very much, Mike. It's hard to make a more persuasive case for this legislation than Jim just made. So thank you very much, Jim. It's an honor to follow you. It's a great pleasure to be with everybody this morning, especially my colleagues who are such champions for our elders, Senator Jalen, Representative Stanley, Representative Rogers, Representative Vitolo. And we have other colleagues on as well who also work very hard to do everything we can to support our elders and to be able to live and retire in Massachusetts with dignity. And I greatly appreciate the good work of AARP. Thank you, Mike and Jessica and your team and all your volunteers for helping educate, policymakers and advocate so effectively. So this particular legislation, to me, this is a real opportunity for a solution to the current workforce crisis that we are facing in our state. As Senator Jalen talked about, and as I think we're all well aware, there just are not, enough people to provide human services, including caregiving, for our elders, for folks with disabilities, for those, who are vulnerable. And by supporting family caregivers, that is definitely one of the solutions to this crisis. So while I've long supported this legislation, I think it's even more urgent now that we take action to do this. As we've heard, this would help people to remain safely at home, living with dignity, keeps people out of more restrictive care, which is also more expensive to the taxpayer. So in fact, this is actually financially also very sensible as well. And it can enable more people to be able to be a caregiver for a loved one and to juggle all of their financial responsibilities at the same time. So the last thing I'll say is, we really have a great opportunity right now to push for this legislation. Governor Healy has proposed a pretty major tax relief package, and I'm glad to see that package already has some support for caregivers, those who have dependents they're taking care of. And also we would propose to double the senior property tax circuit breaker. So those are great first steps to help our senior community, our caregiving community, but we can and should do more. And this tax credit is exactly the right idea. So that proposal is being debated by the House of Representatives in the next few weeks. It will likely be debated by the state Senate in May. And so this is a real timely opportunity to make our case for the family caregiver tax credit. So I encourage everybody to reach out to your reps and senators and for us all to work together to move this forward. So thank you again for the opportunity to be with you today.
Thank you, Senator, and thanks again for your leadership on this issue in particular. Now we're joined by House Chair Dave Rogers, our lead sponsor in the House for the caregiver tax credit. Welcome, Mr. Chairman. You have the floor.
Well, it's great to be with you and great to support this legislation. I'm proud to partner with the AARP and Mike and Jessica and your whole team. I want to thank you for your leadership in bringing this issue to the forefront. And the growing awareness in helping people grow old with dignity is the concept of aging in place. And that is that people tend to do better if they can stay at home rather than go to an institution. There may be exceptions to that, of course, but generally, if we can keep people in their homes, it improves their quality of life and it can save the entire healthcare system a lot of money. And right now in Massachusetts, thousands and thousands, tens of thousands, hundreds of thousands, really, actually, of people, our fellow citizens, are caring for loved ones at home, often with a great effort. Anyone who's gone through this in their own family as I have with my mother who lived to be 95, knows that it's a lot of work to help your loved one, whether it's taking the medical appointments, making sure they're taking their medicine, making sure they're eating, getting proper nutrition. So medical devices, on and on with the list of expenditures that people are now paying out of pocket to help care for their loved ones. And this tax credit would allow some of that money to be recouped to alleviate the terrible burden on caregivers. Now, we've crafted it and devised it in a sensible way to put a limit on what can be recouped. And we've also limited the kinds of expenditures that are qualifying. So it's not open-ended. It's crafted, I think, in a sensible way, because obviously we need to be mindful of cost. But the way the bill is written, I think, strikes the right balance. It, as I said, in my own family, I saw the kind of challenges families are up against. It's stressful. People don't talk about that, the stress it puts on families, because you're caring for, on the one hand, you're caring for someone you love deeply. On the other hand, these caregivers have other responsibilities in their life, in their career and their work, their own children, or what have you. So this is a really important piece of legislation. As Senator Lewis said, I'd encourage everyone to, if you're a staffer or a member, please co-sponsor the legislation. Please talk to your colleagues about it. And please weigh in support, because it's a vitally important issue. So again, I really appreciate the work of AARP. I'm really grateful for the opportunity to be with you this morning, and thank you very much.
Thank you, Chair Rogers. And, I just want to pick up on a quick point about process. We're talking about a legislative remedy, and of course, both Senator Lewis and Chair Rogers have filed legislation to address this. But Senator Lewis also mentioned there is a budgetary process as well. And so rather than get into the weeds now, I just want, for those of you who are listening, to know that there may be an opportunity, even during the budget process, to perhaps get an amendment that would reflect some of the value of the caregiver tax credit, as well as the legislative process through a committee. So we'll keep you alerted to those developments. And suffice to say, I appreciate Senator Lewis, in particular, you mentioning that as a prospect that we all can look forward to, hopefully, and get behind as the session unwinds. At this point, I want to just thank the panel for what you've said and what you're doing. I want to acknowledge as well that we have another group of folks who want to talk about the senior property tax deferral, which is an issue that we're very concerned with as well. What we're doing here is we're pushing for ways to make it easier for people to stay at home as they age, as effectively by addressing one of the biggest challenges, which is property tax burden. And there are some real high costs associated with, owning a home. Property taxes can be a challenge. There is an existing senior property tax deferral law, but it definitely needs some update. And what who we have now to talk to us are, we have an advocate, Pat Walker. We also have our lead sponsor, a great friend to AARP, Tommy Vitolo, the state rep, who is sponsoring a senior property tax deferral proposal. So Pat, you have the floor. Tell us what you have to say.
Okay, thank you. First, I just want to apologize for sounding so congested. I'm just getting over a cold. As Mike said, my name is Pat Walker, and I live in the town of Sharon. I'm widowed, a mother of 4, and a grandmother to 3. I've worked in the healthcare industry for over 45 years now. Currently, I still work a minimum of 60 to 80 hours per week. I've lived in my home for over 30 years. This is where I raised my kids. This is where my grandkids come. This is where they know as grandma's house. Now, my concern is that I want to remain in my house and I want to be able to retire. But as it is right now, there is no way that I'll be able to maintain my home and not working. And after 45 years, I do love my job, but I would like some time off to enjoy my kids. And if my health does not support it, I will not be able to stay in my home. And with the deferral, it would make it possible that I would be able to at least reduce my work hours, if not able to retire. And I am not the only one. There are lots of people within my town who I know are going through the same circumstances as myself. So excuse me, today I'm asking that you support this bill, which is House Bill 2974 or Senate Bill 1847, so that people like me who have served this community will be able to age well within this community. I thank you for the opportunity to share my personal story, and I hope you encourage your colleagues, if you're already supporting, ask for the support of other members so that we can pass this bill. Thank you.
Thank you, Pat, very much. And for our lead sponsor, Representative Tommy Vitolo, thank you for joining us today. And thank you for all the leadership and all the hard work you have been putting into this really important issue. So you have the floor and love to hear from you.
Thank you, Mike.
Thank you.
As he mentioned, I'm Tommy Vitolo, the representative from Brookline. I want to begin by thanking the speaker who has made it a point to make sure that whatever bills we're looking at, we're asking, hey, how does this touch seniors' lives, or how could it touch seniors' lives? And sometimes we can get small improvements in things that aren't on anybody's radar, and they add up to make a difference. And I'm grateful to the speaker for his leadership. I'm also very grateful to work on the Joint Committee of Elder Affairs under chairs Tom Stanley and Pat Jalen. They have taught me so much about how to work on issues that relate to seniors across the broad spectrum of their lives. Seniors are the most diverse group in the Commonwealth. And they've been very, very helpful to me to learn sort of the ropes. Finally, I do want to give a huge shout out to both Sandra and Mike, who are absolute rock stars in this building. When they show up, the legislators pay attention. So folks who are members of AARP in Massachusetts couldn't have a better team. And like I said, when Mike swings by my office, I'm all ears, because he's coming to me with important fact-based information that's incredibly persuasive. And so I'm grateful for his advocacy. The bill that I'm focused on kind of stems from my experience with my in-laws and my parents, and how that experience is different. Now, they all live in the South. My in-laws were very fortunate. They were able to plan ahead. They got ahead and they downsized. They downsized into a home that was fully ADA accessible with French handles and wide doors, because they knew that my father-in-law, Phil, was likely to end up in a wheelchair due to some neurological problems. And they were able to reduce their costs and be in a better space. And it was very fortunate. They were smart. They were lucky. They had great support. It was wonderful. My parents, on the other hand, are in the same home they've been in since 1993. They don't go upstairs. They don't feel like they can move out. Their physical health isn't strong enough. Emotionally, they're not there. They don't really get out of the house much, but they still have the lawn. They still have the expenses, and they still have the taxes. And they're trapped is too strong, but maybe they didn't want to be in their house. They are, and they've got to carry those costs. Some folks aren't trapped, but folks like Pat, they love their house. They want to stay in their house. They love their neighbors. They love their community. They want to stay. In all cases, we want to support seniors where they're at. And so the vision of this bill is simple. In Massachusetts, many seniors outright own homes that are worth 10, 20, 50 times more than they paid for them. But they don't have the cash flow month to month to cover their ongoing costs. You know, their Social Security isn't going to keep up. Their pension isn't going to keep up. And, you know, as Prop 2.5 trudges on year after year, communities that need more tax revenue for local services, for buildings like schools, they come to the taxpayers. They come to the property taxpayers. And so the idea is that seniors who are fortunate enough to own this single large asset that you can't sell 2% of your house. Not really. You know, there are some options there, but they're not great. Some folks, it's really simple. It's how about if I just pay my property taxes later? That's the big idea of property tax deferral. You're still going to pay your taxes. You're still going to contribute to your community, but you're going to do it later, not now. The problem with the current law is that it's simply not designed for many people to use. And so what we do is we change all the knobs so that it's easier to use. For example, currently you're required to be a 5-year resident of your home and a 10-year resident of Massachusetts. I don't think that matches our 2023. I say if you're a senior and you live next to me and you otherwise qualify, you should be able to get in even if you moved in yesterday. We also increase the income eligibility to the senior circuit breaker tax credit, which, by the way, we're trying to increase so that more folks are eligible and so that they don't have to give their entire tax return to the town in order to qualify. They could simply demonstrate they're eligible. And that clears up paperwork and also expands access. We want to reduce the default interest rate from 8% to a rate based on what your actual local community is paying in interest so that your city or town isn't making money or losing money on you. Fair is fair. And finally, not quite finally, there's more. Under the current program, the moment the house is no longer owned by the senior, either because they sell and move or because they pass and it goes into the estate, that interest rate goes from 8% to 16% the next day. I don't think that's fair at all. I think it's reasonable to give folks a year to settle the estate, to move all the belongings on to relatives, to clean the place up, to wait for spring, to sell it at its highest value. So let's not take advantage of folks in that situation with usurious rates. Let's keep that lower rate for a full year after that house is no longer owned by the senior. And finally, we require the municipality to inform the participants of their current balance at least annually so that the seniors and, where appropriate, their financial caregivers are aware of the financial circumstances, and so that everyone is making the best decisions for them with as much good information as possible. The senior property tax deferral is a great idea. I think initially, maybe it wasn't rolled out to be as broad as possible in fear that there'd be too many participants. There are not too many participants. Communities can certainly expand this program, but they can only do it if we pass this law. We've been working on it for a couple of sessions. I'm really optimistic with the AARP's wind in our sails. We're going to get it across the finish line this time. And I'm looking forward to more seniors having more choices about how they want to live given their finances if we can get this bill passed.
Thank you, Rep. Boy, I'll tell you, I'm sure everybody would agree just listening to you. You are a passionate advocate for seniors and a delight to work with. Your kind remarks are most appreciated. And suffice to say, we'll do what we can do. And those who are participating, those who are watching our emails and seeing our social media, when the time comes and we know this is going to be before a committee, we'll be sure to inform folks and get them engaged to put wind behind your sails, because
no question, this is the kind of a bill where written testimony or oral testimony, but written testimony is great. You don't have to show up.
Yeah.
If I can have a stack of letters from seniors saying, this is the thing that allows me to really enjoy my time in my community, that can really make a difference in getting this one passed. So that would be
we'll do our part, and you'll get your stack when the time comes, and you'll certainly get some live testimony when the time comes as well. Well, listen, this has been great. I do want to mention now, we're going to go back to Sandra Harris, who's our volunteer state president, who's been a wonderful advocate day in and day out for these issues and a number of others. Just to make a quick point, Sandra is going to speak to what you can do. For those of you who are listening in, who are part of Lobby Day, what you can do based on what you've heard today, if you're interested, to help us get these bills across the finish line. So Sandra, you have the floor. Look forward to hearing what you had to say.
Thanks again, Mike.
Thank you.
As we near the end of this session, we are urging you to speak to your legislators about all the important bills you've heard about today. Urge them to speak with their legislative leads to get these bills passed soon. As a reminder, AARP Massachusetts state legislative priorities for 2023 are, and we urge support of, the Family Caregiving Tax Credit, House Bill 2932 and Senate Bill 764, nursing home improvements, House Bill 615 and House Bill 648, and Senate Bill 379. Senior property tax deferral, House Bill 2974 and Senate Bill 1847. The core plan expansion, House Bill 3031 and Senate Bill 2025. And lastly, the Work and Save program, House Bill 996 and Senate Bill 6224. Even though we couldn't speak on all of the issues that matter to our members, know that we are also supporting bills to bring down the cost of prescription drugs, housing, funding for home and community-based care, councils on aging, and SNAP. As we leave, let's promise to share our stories. Let legislators know how these issues are impacting us and our loved ones. Let's tell legislators we need action now. If you're not already signed up to receive our alerts, please sign up at www.action.aarp.org. Thank you for attending the AARP Massachusetts Advocacy Action Day. Enjoy the rest of your day. Thank you.
Thank you, Sandra. Okay, it's my turn to bring it home. I just want to make a couple of quick observations. You know, there have been a number of folks who have put their questions in chat. I think our team has done a great job answering those questions. Suffice to say that we'll have that information, and if we can follow up, we will do so. I do want to urge you to consider that if you do have a question that requires follow-up, you know you can always reach us. And let me just give you, first and foremost, we have a phone number, a toll-free number, 866-448-3621. You can call us during regular business hours. If you need to get in touch with me, it's mfesta@aarp.org. And certainly we'll get your question or we'll respond to any inquiries you make. I just want to end by thanking each and every one of you, in particular, first and foremost, our legislative heroes. These are folks who have taken leadership roles on our issues at AARP, but frankly, they are showing up in the legislature in a number of ways that improve the quality of life of our seniors and frankly, all constituents of the Commonwealth. So I want to thank them for their commitment to public service. I also want to thank those staff members of legislators and legislators who participated, who listened in to today's lobby day. I also, and most especially, want to thank our members, those of you who responded to the invitation to join us today for lobby day. Remember, this is the fundamental point. Your personal stories, your experiences living in the Commonwealth are what make all the difference in persuading legislators to do the right thing when it comes to priorities that we've been talking about today. Stay involved. We really do need you. It's not a long commitment of time, but it's a very powerful message when you yourself are able to talk to your legislators. So thank you for participating in this lobby day. We do one every year. We have a lot of action coming up in the legislative session that you heard about today. So please know that we appreciate your participation and we look forward to working with you in getting these very important priorities passed as part of the legislative process. Have a great day and enjoy the spring. Thank you.